GLYS, short for Gay and Lesbian Youth Services of West New York, is stepping up following a decision by the Trump administration.
The 2026 federal budget plan cuts services for LGBTQ plus youth, which had been offered on the 988 National Suicide and Crisis Lifeline. Right now, we're joined by GLYS Executive Director Jack Kavanaugh. Jack, thank you very much for coming in this afternoon.
Yeah, thank you for having me.
So for anyone who might have missed the news, if you can, maybe go into more detail about what exactly was shut down by the Trump administration.
Yeah, so for the past few years, since they launched the dedicated suicide hotline, 988, they added an option where you log in and you could hit option 1, which was specialized care for veterans of armed services, as well as option 3, which was specialized care for LGBTQ young people. And what that would do was funnel those calls to specifically trained national call centers to work with LGBTQ young people. What's happened now is the funding for that national specialized kind of funnel for LGBTQ youth to access suicide prevention care has had its federal funding cut. And so, what we're going to see now is that you'll still be able to call 988 and get access, but it won't be able to access that level of specialized care from specifically trained providers that they used to be able to get, which is really, I think, disappointing.
And what is the impact, you think, from not getting that specialized care? What do you think the ripple effect will be?
Yeah, I think it'll be significant. Transgender young people particularly, as well as gender nonconforming young people, have some of the highest rates of suicide across any subdemographic of youth, particularly trans and non-binary youth of color. And I think one of the things that we're going to see is, unfortunately, an increase in negative mental health outcomes, potentially suicide attempts, potentially suicide completions and deaths as well for young people who are not able to access that specific care that they need. And I think, locally, we were trying to find some ways to provide those services. The Trevor Project has a dedicated national line as well that young people can call, text into, and that is actually where a lot of the national funds were kind of being filtered towards. So they won't have the capacity that they did, but you will still be able to call them directly, which will be really helpful. Hopefully. And locally, obviously, we still have Crisis Services, who's wonderful and does great work, but I think we're really going to miss that really specific, specialty-trained clinicians.
To piggyback off of what you were saying before, you mentioned the word disappointing, right? What do you think is the importance of having, a specialized option for LGBTQ plus youth? Yeah,
I think it's similar to, like I said, there's a specialized option for veterans of armed services. When you have a population who is at particularly high risk, particularly at risk for suicide, you want to make sure that you have people who understand and have that level of cultural competence to be able to speak to those issues in a way that is really particular, in the same way that we see in mental health care for veterans. And I think, that type of specific culturally competent care for high-risk groups has just been such a foundation for mental health services over the past, in my professional career, in terms of where the evidence tells us is the most effective. And so to lose that is unfortunately, I think, going to have some pretty negative ripple effects.
Let's talk about the resources that are going to remain. You had mentioned about Crisis Services, also the Trevor
Project.
The Trevor Project?
So a national organization.
What's that? Can you tell people
Sure.
about that?
The Trevor Project is a national organization that focuses on suicide prevention and mental health support for LGBTQ youth. So they operate a 24/7 suicide prevention hotline that you can also text into. You can go on their website, it's just trevorproject.org, and chat with them as well. So for a lot of kids, that's more accessible, be able to text or chat instead of getting on the phone. And so they have all of that available nationally.
And before we let you go, it's not just on a national level. There are a number of resources here in our community, not only for youth, but for all members of the LGBTQ plus community. If you can, run through some of those for us.
Sure. So obviously at GLYS, we work with young people ages 5 to 21, as well as parents. We have a drop-in program twice a week. Our website's GLYS, GLYS WNY.org. We also offer twice-a-month support groups for trans and non-binary youth, as well as parents and caregivers. But then we also operate the Pride Center of Western New York, which is focused on adult care. And so we have a number of support groups, support services for adults in our community as well. If you need access to support on housing, employment, whatever that looks like, all the way from age 5 to, our Silver Pride senior support. Between the GLYS and the Pride Center, we can hopefully provide support to everybody.
All right, very good. Jack Kavanaugh, thank you. Thank you for the work that you do.
Thank you.
Appreciate it.